So I'm left with a distal and mesial root. What you want to do is this. Yo, what up? It's a tip of the week, and today we're going to discuss removing root tips. Now, I wouldn't necessarily title that, but one of the doctors that reached out to me, he's been watching the shows just like you are, and he was just like, hey doc, how do you take out these teeth, especially if a root breaks or the tooth fractures? So I'm like, all right, cool. Well, what I'll say is this is Dr. Marshall Titus. Dr. Marshall Titus, he reached out to me. He was like, hey, how do you handle a situation like this? Well, he didn't give me any x-rays. He was just like, how do you manage these? So I'm like, okay, cool. I'll do the best I can with little information. But if you're first time watching the show, I'm Dr. Jared Williams. I'm a concierge dental surgeon out in Houston, Texas. And I go from office to office doing third molars, IV sedation, implants, and also coaching. So if you're a doctor that wants to improve on their surgical technique, these are the videos for you. And so if you want to do a one-on-one consultation or have me come to your office, or if you want to come down to Houston and just shadow me, we are always looking to make the world that much better. So if there's anything I could share with you to make your production go up and your patients smile, we got you covered. So I'm going to throw up this x-ray right here. As you can see right here, this is tooth number 32. I will make the assumption because of where it is on the nerve. All right, so let's just say this tooth was in my hands. And Dr. Titus, I would say this, and for all you guys have this question, it's cool because if one person has a question, a lot of other people have the question. So this x-ray was sent to me, one of my coaching clients. They asked me, just, hey, how would you manage this case? So Dr. Titus, this is for you and all those around the globe watching. So in this particular situation, number one is this. This is not the x-ray that I would use to take out any tooth. It's not. This is a disaster waiting to happen. If you were to go to court and let's just say the patient had a paresthesia or didn't have paresthesia or whatever the case, something happened, they're gonna ask you, is this the best x-ray you had? And if it is, why don't you have something else? And they're gonna literally be looking for a CT scan and or pano. Because right now we can't determine that this x-ray is telling us anything. It's non-diagnostic. Now it can tell you a couple of things outside of it's close to the nerve and there's a big cavity on it. But if you look right here, this is not enough information. So first things first, gotta have the right radiographs. Let's start there, ladies and gentlemen. Then the next thing is this is like, I know for you guys, let's just say you're not past, you're still kind of questioning how to get a patient numb. Well, I got a book. I wrote the book on it. Right now it's free, but I don't think it's going to be free long because I've gotten so much exposure to it that we're probably going to be pulling it off. So if you haven't gotten your copy, get it now because I can't say that it's going to be free forever. So just want to throw that out there. Another thing is this. Once you got the patient a good x-ray, that they're nice and numb, then we're going to go about how do I get this tooth out. So first things first is this. You want to grab your elevator. Now I'm not gonna tell you what type of elevator this is. You wanna come in? This is my future doctor. Well, I wouldn't say a doctor. She'll probably be a businesswoman. She's really good at that. So anyways, this is my daughter. She's gonna help us out. We like this hair. Her mother's gonna kill me, but whatever. So anyways, first things first, I'm gonna tell you about this elevator. Hold this out here. This is an elevator, and typically speaking, I'm not gonna tell you the elevator because I told you that if you've seen the videos, you know what type of elevator it is. But anyway, this is the type of elevator that you wanna get. And when you get this elevator, all I typically wanna do is just piece around to see where I could get the tooth to actually be removed. So just to answer Dr. Titus's question, typically what I want to do is ensure that the roots are taken out. So let's just say I took out this tooth for whatever, I did everything in my power to make it work. So just want to make sure that everything is done. Let's just say the crown cracked off. So I'm left with a distal and mesial root. What you want to do is this. Take your surgical handpiece, 45-degree angle, go right here in the furcation, a millimeter or two below it. Once you go millimeter or two below it, then what you want to do is drop your elevator in between and snap it into two pieces, which means you have a mesial and a distal root. Once you have the mesial and the distal root, then from there, what you want to do is slide your elevator into this area right here, the alveolar housing. You have the bone here, and then you have the roots here. typically you want to do is just be gentle and be patient. So if I inadvertently fractured the crown off and I couldn't get it out and I got to take these roots out, it's fine. What I'm literally going to do is I'm just going to be a little bit more patient. So that's step number 3. Be patient. Don't try to rush this crap, because all you're going to do is get frustrated. And if you deal with kids and they piss you off, like this one does to me sometimes, you know that you got to have patience. And so if you have kids, it should be even that much easier. But if you do have kids, you're not patient, it's just going to take you to the next level. So just make sure that you are literally being patient. So what I literally do is I'll take this elevator and I'll stick it in the brazier, and I will stick it there, and I'll be finding a little purchase that I could find it in the buckle or in the mesial area right here, and I'll just stick it in there and I'll just press and hold. And literally what I'll do is I'll watch a little TV, look at my assistant, look at the patient breathing. I'll just kind of just find a little purchase point that I could stick it in there and literally get this tooth wiggling. Once I see that blood going, then we're good. Same thing on this one. I will do the same thing. Well, I'll do it on the mesial first, but if I really get a good spot, what I'll do is if I'm able to get this one out, this mesial root out, safety first, in my sterilized pack, what I'll do is I'll go ahead and grab my east and west. And as you can see, all these are color coded, so you know that I'm working with these, right? Thank you. And so what I'll do is this, I'll get my east and west and I'll engage it into this distal root, scoop and score. So I'll stick it in, hold it, you hold it, hold it, hold it, hold it. Stick it in like this, and I'll scoop. Now this is sharp, is it sharp?
No, not that sharp.
Oh, is that right? Well, what I'd say is this: it's sharp enough to cut you. Stick this in the into the distal root and scoop it, and that's how I'd manage this. Now I'm gonna pretend as if this inferior alveolar nerve is not even an issue, but once you do that, that's how you end up taking care of these roots. And guys, I do the same thing if we're on the upper. I don't have an x-ray for it today. Maybe if you want to share me an x-ray in the comments and say, hey doc, how would you manage this one? We could talk about it, have the world benefit, and you get better. You'll get prepared to serve more patients. You'll make more money. And the whole purpose of this channel is to help you smile through surgery. Like my goal, my secondary goal is to put money in your pocket, number 1, show you how to think, and I'm no longer necessary for you. Because that's how true knowledge is passed down. So there you have it. Was that simple?
Yes.
All right. So if a 6-year-old could understand it, there's no reason somebody who has almost 6 years of training can't yourself. All right? You ready?
Peace out.
I don't end it that way. So there you have it. I'm Dr. Jared Williams, and it's an honor and privilege to serve. I know I'm offbeat because my daughter's right here. She throws me off, but it's cool. I have like OCD and some other challenges going on in my head. But I just wanted to give y'all some insight on how to take care of this tooth. So once again, if it's your first time to this channel, I want you to like
and describe.
What? Describe. Like and subscribe. And,
I just said that.
All right, you said that. And then we need to smash the like button. Smash the like button.
Smash the like button.
And don't be a squeezer.
And don't be a squeezer. And smile after surgery.
And go ahead.
And smile after surgery.
So if a 6-year-old could do it, you can too. All right, guys, I'm Dr. Jared Williams, and I want you to remember, what looks hard is often
easy.
She's got it. Now do you. All right, guys, make it a great one.